hopefully soon. Will this be recorded and sent out afterwards? It will be recorded, yes. You will receive a link. It will be on our YouTube channel. So you will get a link and you can look at it also afterwards. References would be great, thanks. So if you would like the references for that was about the early maladaptive schemas research, you have my email here, Vladimir@skinpick.com. So please email me and I will send it to you. Just have mercy on me and give me 24 to 48 hours to respond to your email. I have I have dermatophagia and onychophagia. Will this webinar help me as well? Yes. Well, I hope this webinar will not give you specific answers to these questions, but I hope you were able to find something of use for you. Do you know if there are any doctors working in the area of SPD in Ireland? Thanks. On top of my head, no, but that doesn't mean that there aren't any. So a major problem that people who struggle with skin picking that they have is usually that they can't find a therapist who would work with them. In terms of prescribing medication, any psychiatrist can do that, or at least should be able to do that. In terms of doing psychotherapy, often therapists will not take you seriously. I've had so many times people write me that their therapist would tell them, well, you should just stop, which is, I suppose, the most annoying answer you can possibly give people. So in that sense, you might have a harder time finding a therapist, but you don't need a therapist that is specifically trained to deal with skin picking. What you need is a therapist who will listen to you and who will be willing to learn. There are plenty of resources out there. If you have a therapist and your therapist doesn't know what to do with you and doesn't know how to help you, they can find resources. If they can't find resources, have them email me. I'll send them references where they can learn. So there's literature out there. You just need to find an open-minded therapist. So sorry, just to go back to a more specific answer, I really don't know anyone in Ireland who specifically works with this. Curious, does SPD refer to scalp or any part of the body? So skin picking disorder refers to skin picking in general. It doesn't matter where you pick. People will pick literally everywhere. Most common sites that I can think of would be face, arms, and pubic area. This doesn't mean that, this is just from my experience and my clinical practice. It's not a study that I'm citing. Is there a way that I can listen to your last webinar? I would like to catch up if possible. So yes, if you signed up for the previous webinar, then somewhere in your inbox, you should have a link to the YouTube recording. If you didn't, you will then get a link for this one. Just go to the channel then and find the previous one. You have this point, there are 3 webinars. This one that talks about the psychology of skin picking and sort of psychotherapeutic work. And then the first one, which was about COVID-19, was in April. So you can listen to all those. And I promise you will find Kelly's name in each of these. I had a TIA in 2003. So TIA is a transitory ischemia, which is a type of mild stroke. I was misdiagnosed with cerebral vasculitis and was given prednisone. I actually have moyamoya disorder. I developed steroid-induced psychosis and spent time in 2 psychiatric hospitals. The psychosis then triggered bipolar disorder. Although I've had SPD since I was a teenager, it's become much worse since 2003 when I had the TIA. I'm wondering if you see any connections here. So I have never had a client who had a vascular incident like that and then had skin picking because of that. And TIA, in theory, by its definition, should give only reversible symptoms. So if you had a TIA, all the symptoms caused by it should have disappeared. Although maybe a neurologist would be able to give you a better answer, because this is not something that's strictly in my domain. I'm just speaking from my med school memory. What could have what I can sort of claim for sure that could have made skin picking worse are two other things that you mentioned, which is psychosis and bipolar disorder. I've had clients who have had bipolar disorder and skin picking, and sadly, both sort of facets of bipolar disorder, the hypomania or mania, and also depression, can both induce skin picking. So either way you look, bipolar disorder can make it worse and can also make it difficult to manage as well. So that's where I can, where I see connections and that I can share with you. Do you know whether there's any research that examined if there's any association between skin picking or skin picking disorder and sensory processing or sensory processing disorder? So in these specific terms, no. However, if you remember what I was saying in this study about parietal cortex and the supramarginal gyrus, they have to do with tactile sensations and also with needing to pick when you feel a bump, when you scan your skin. So there are some associations, and if you like, I can check so Medline or PubMed. I can Google it for you and then send it to you if you just email me and tell me what your address is. But to my knowledge, specifically, no, although this study does touch on the subject. I'm surprised that it's a slight digression. I'm surprised that there aren't many studies that actually study the sensory aspect of picking, considering that it is quite important. And very frequently when we find competing responses in therapy, it's how they feel that's quite important for people. So I mentioned woolly stones before, this one that I have. This one, for example, is very, very polished and very smooth. And then some people will prefer the smooth ones. Some people will prefer the more rough ones. So the sensory sort of aspect of it is incredibly important. So I'm surprised as you are that it's not the main target of research. Please address the role of antidepressants in stopping SPD OCD. The reason I asked is this. I picked my scalp for many years, wanting to stop, but finding that automatic aspect. Okay, then my scalp got very itchy. I was diagnosed with scalp dysesthesia and also prurigo nodularis, which is a type of itch, which I don't believe, sorry, you don't believe you have the letter. But anyway, I finally contacted a psychopharmacologist, and now I'm taking low-dose fluoxetine and doxepine. Scalp dysesthesia is there, but I'm thrilled that the scalp picking is a thing of the past. So you may have asked this before the slide where I talked about fluoxetine. So you are among those people that have experienced benefit, but as you could have seen, it doesn't really work for everyone. So I'm really happy that it does work for you. Is there any comorbidity of dermatillomania with autism, for example, in terms of routines and repetitive behaviors? Yes. So I don't work with too many clients who are on this. Well, I do have clients who are on the spectrum, but clients who are sort of severely autistic with very pronounced symptoms, I don't have too many. But I have, when I was just out of med school, I worked in a psychiatric hospital at the Department for Children and Adolescents, and many of my patients back then were autistic. And yes, skin picking was quite common, but that's not something that I would approach in the same way that I approach psychotherapy. I suppose that depends on the level of cognitive development as well. But very frequently, that's what you would treat with medication more frequently than with psychotherapy. At least if we're talking about an autistic person that has difficulties functioning or difficulties with verbal skills or understanding speech, which, as you know, can all happen in autism. But otherwise, if it's a functioning but just neurotypical person, they can of course benefit from psychotherapy. Might have been just my sheer will to stop, and taking a pill, even if it was placebo, it did the trick. Yes, I'm not. I have to say, a placebo effect is obviously a very real thing, but I have to say I'm not a big believer in force of will in psychological change, because I think it's something that works for a period of time, but not forever. Because usually willpower is something that's like a cell phone battery. You know, it works for a while, but then you need to recharge it. So it doesn't work forever. Do you know if there are any products that resemble skin pimples that can be picked or popped? No, I don't, but there are things that you can use to emulate that. So bubble wrap usually works for people. And then what you can use is pencil erasers, at least the softer kind, and then you can pick those. You can also use some of the squeeze toys that are obviously meant for squeezing, but you have the very soft variety. I had one and I would happily show you, but my dog ate it, and I'm not joking. It was very soft, so it was very good for picking. So that's also something that you can use. There's also a number of sensory toys out there. They're of course not meant for adults, but you can use them anyway, and they can also be beneficial. What is decoupling? So decoupling is a procedure where you disassociate certain movements with certain actions. So that's what it would be. If this movement always leads to skin picking, for example, reaching towards your hair or towards your face, you would learn to sort of do the movement, but then redirect it to something else in the last moment. It's not a particularly shockingly intelligent technique. This sounds very fancy. And also, like I said, it's iffy in terms of how well it works. Can you provide information on your background, education, location, phone contact, and online program? So if you want to see my biography, I'm not a very big fan of talking about myself. You can go to the SkinPick website and you have a short bio. So the way I can work with people, and I don't know, perhaps some of you, is via SkinPick program. So it's a completely online program. There's nothing offline. It's done in writing. So you can go to skinpick.com, or if you want to know about the program, you can email our support team. If you have a question about sort of how I do therapy, or if you need any information about the studies that I mentioned, you can email me to my business email, which is Vladimir at skinpick.com. And also, SkinPick is not my company. I'm just a therapist that works for the company. I don't think I could ever make a company successful because my business instinct's not the best. What does ACT stand for in the psychotherapy slide? Acceptance and commitment therapy. So ACT belongs to what we call the third wave of cognitive behavioral techniques, which just means the latest ones that we have. ACT is different from traditional cognitive behavioral therapies because it incorporates elements of mindfulness and sort of elements of it teaches you how to be with your experiences rather than to avoid your experiences, and how to connect your experiences to who you are as a person. So it goes a step up from, as opposed to, you know, traditional CBT, which teaches you how to think differently or behave differently. I like to call it CBT with soul. It's like halfway between more insight-oriented therapy and cognitive behavioral therapies. Where can I find help using ACT HRT method? So I suppose if you want an online program, SkinPick can be a solution for you, but otherwise, if you prefer face-to-face encounters with your therapists or an offline program, if that's possible, wherever you live, considering the weird public health situation we're living through, you can find any acceptance and commitment therapy practitioner. So you can just type ACT practitioners around me and you will find one. ACT is quite a popular therapeutic modality, so you shouldn't have a very hard time finding people who practice that way. How can we be a part of more studies to help doctors gather more info? Well, that's a very good question. So university hospitals usually will put up ads, or if you have a psychiatrist or a psychotherapist or a GP that's associated with a university hospital, you can ask them and then volunteer in a study. Unfortunately, there's very little research done on skin picking. Even though up to 5.6% of the population have it, it's really not well researched. Um, if someone has autism and ADD and exhibits skin picking behavior according to skin picking disorder, in response to stress, boredom, etc., do they have skin picking disorder, or is it just a symptom of another condition, therefore not skin picking disorder? So you can have autism and skin picking disorder separately, because skin picking disorder is basically just compulsive skin picking that causes physical damage and that sort of causes issues with everyday functioning or in social interactions. So that's the definition of a skin picking disorder. The question is in for you specifically, if you're asking for yourself or for whoever the person is there any benefit to diagnosing them with yet another disorder? Because sometimes what I see is that when people go to different doctors, they will receive 5 different diagnoses, and then they will say, I have OCD, SPD, ADD, whatever 3-letter acronym you can come up with. And then you ask yourself, well, is there any really practical value to this? If someone has autism, for example, are you going, and they also pick their skin, I think it's really not very useful to try to discern whether it's part of the autism presentation or is it part of the skin picking. The question is what would really practically help that person. For someone to use competing responses or stimulus control or any of the cognitive diffusion or restructuring techniques, it doesn't really matter what they have. So I wouldn't really sort of spend much time thinking about whether or not something is separate if it doesn't affect how you will go about treating it. That's part of my very pragmatic approach, which is the question is how you get rid of it and whether or not something works for you, not how you would necessarily call it. Do you recommend any books for self-help with this issue? I have to say, unfortunately, there are very few out there on the market anyway, and there are few that I think are specifically good. I'm looking down because I have my Kindle here. I was just going through one, so I will tell you which one it is. Just give me a second. You check my library. Also, there's a book called Overcoming Body-Focused Repetitive Behaviors, a comprehensive behavioral treatment for hair pulling and skin picking. That's a relatively new book that you can check. The authors are Sherry Mansfield and Charles Mansueto. So that was a decent enough book. The trouble with decent enough, I really don't mean to be smug or critical, it was a good book. The only problem that I have with self-help programs is that most people who try them give up halfway. One thing about joining a support group or a forum or a therapy group or individual therapy or whatever is that you have someone to hold you accountable. And sorry, when you do everything alone, it is much more difficult to sort of keep up with it. But that, for example, offers a comprehensive program that you can follow on your own. Is there a proven relation between nutrition and BFRB? I find sugar affects me negatively and increases my BFRBs drastically. Just 1 second. No, not to my knowledge. There are no studies that looked into this. In general, people tend to connect sugar to all kinds of things, and there's not too much science out there that actually confirms this. However, from a very practical therapeutic point of view, if that works for you, well, then by all means, reduce sugar. I really am very pragmatic that way because I don't think the absence of scientific evidence for something doesn't mean that that something doesn't exist. And also science can say what works for most people, but not what works for all people. So in that sense, I'm really very much inclined to trust your personal experience. What you can do is you can even experiment with different nutrients or different supplements or different diets and then just see what works for you. But one thing that I would definitely caution you against is finding or only looking for solutions in that department. I don't think that can possibly explain everything about skin picking. Hi, thank you very much for the excellent information. Well, you're welcome. I'm glad you enjoyed it, especially for all the studies. Question, have you heard of EMDR being helpful for skin picking? Um, I have not found a study that says that EMDR is helpful, which again doesn't mean that it's not. In the past, I've had clients who have tried EMDR, and some of them have experienced certain benefits from it, although I cannot recall anyone that completely stopped picking because of EMDR. But please keep in mind that my sample is not really the most unbiased sample in the world, considering that if someone comes to me or to SkinPick and say, hey, I'm struggling with skin picking, chances are whatever they tried before either didn't work or only worked partially or temporarily. So I will say it works to a certain extent for some people, but that should not be used to discount EMDR. However, if I were to recommend a course of treatment for a friend, let's say, EMDR wouldn't be my go-to. I wouldn't consider it at all. What is NAC? It's N-acetylcysteine. It's a supplement that you can take. I believe it's an over-the-counter supplement. You say labeling our conditions affects treatment. Is there positive statements that would help? So what I meant by this is that if you look at something and conceptualize something as being, for example, only genetically determined, you can't really change your genes. So that doesn't open up a whole lot of options for you in terms of getting rid of something. That's what I meant. I'm trying to come up with other examples now. Sorry, I'm struggling to find another example, but so depression is really a very good example. Psychiatry has this tendency and has had this tendency for over half a century to focus as much as it can towards the biological. And very frequently today, people, when they're depressed, they will talk about their brain chemistry somehow being off. But when you look at the research, for example, and many psychiatrists will prescribe medication because they're overloaded with work, because they really believe that it is only chemical and nothing else, or because they're just not trained to provide psychotherapy. But then they will give you medication and then explain how the medication works, and then they will tell you, well, that's brain chemistry. But when you look at all the science that we have, we actually see that sometimes psychotherapy is superior to medication. But you don't see fairly many psychiatrists who say, throughout the medication now, let's just do therapy. My point is that we sometimes preempt disorders to just one thing, and that's never really useful. Because if you look at depression as being only biological, and you don't find antidepressants that work for you, then what do you do? If you keep an open mind and sort of are more willing to try out different things, you're more likely to have more options available and therefore find the solution that works for you. That was my point. Thank you. You're welcome. Do you have SPD? So I don't tend to answer private questions like that. I'm perhaps maybe old-fashioned as a therapist like that, but I don't like to talk about myself. Do you do Zoom therapy sessions? If so, are you taking new patients? So I'm today here, I'm talking on behalf of SkinPick. So the only service that I can possibly provide in this venue is well, the SkinPick program, which doesn't include by default Zoom therapy sessions. Sometimes clients are willing to upgrade and pay more and then have also video or audio sessions, but typically SkinPick is only in writing. I do have my private practice, but that's sort of off limits when I'm talking about SkinPick. Thank you, this was very helpful. You're welcome, I'm glad it was helpful. Are there any links of SPD to addiction or addictive physiology? So maybe you didn't join from the very beginning, or if you did, maybe you missed it, but one of the most common co-occurring conditions with skin picking is substance abuse. So we know statistically that one frequently goes with the other. That's about as much as I can say from a scientific point of view right now. What is NAC? So I answered a similar question. just now. I primarily only pick the skin on my right thumb. Is it normal only to pick one area? Yes. So there's no rule in terms of whether or not you're diagnosed with SPD or not. It doesn't matter where you pick or how you pick. It's just that you pick, that it's compulsive, and that it causes damage and functional impairments. Most people pick in several places, but you have people who pick only in one place. There's really just, it's very different, and every client has their own story and their own distribution of picking sites. How do I find a therapist who specializes in SPD? So there's the SkinPick, of course, but I feel now like a parrot at this point repeating the program. There are also other services online that I've noticed, and certain people who call themselves as SkinPick coaches. I'm not sure what qualifications they have. There's a foundation that's dedicated to BFRBs, so you can contact them as well and ask them for references. But I don't think, again, necessarily that you have to aim for a therapist who specializes only in this. If you want habit reversal training only, then by all means find someone. But it is very likely that your therapy is not going to end with skin picking disorder. I'm not a big fan. So as therapy progresses and changes, as there's a lot of burden nowadays to have evidence-based findings in therapists, so they have to design, so we have to design therapies to fit specific conditions. But I have to say that I slightly feel resistance towards that, because I don't think you can treat just one symptom in a person. What does it mean to do therapy on skin picking, for example, if we discover that skin picking is related, I don't know, to past trauma or abuse or emotional regulation problems or family issues? What am I supposed to say if I specialize only in SPD? I will help you with habit reversal, but if you want to fix your trauma, then you have to find a trauma specialist. I don't think that creates a very good and accepting environment. I think any therapist can help you, even if they don't have experience with SPD, if they're willing to learn and listen. Because the solution is not in whether or not you will use this stimulus control or that cognitive diffusion or whatever. The answer is, one, in the relationship you develop with your therapist, and also in your willingness and the willingness of your therapist to experiment and try out different things. So you just need an open-minded therapist more than anything else. Once you pay $200 to start the program, what does it include? I missed the start of the Zoom chat. So you don't pay $200 for the program immediately. You pay monthly. Oh yeah, you do. I'm sorry. I misread the message. Yeah, you pay $198 per month. So when you start the program includes written communication with the therapist, which is unlimited. So you can talk every day if you like, well, write every day if you like, or you can do a couple of times a week, whatever works for you. And then every week you have a sort of a text to read, you have a worksheet to fill out, and you have some techniques to try out or a different kind of assignment. Before you go to habit reversal, for example, you do something called awareness training. So every week you have a task that you have to do, which you then evaluate with your therapist and discuss. And also parallel to that, you can talk about anything that you like with your therapist. You don't have to limit yourself only to SPD. I realize that this wasn't a very systematic explanation of the program, but you can ask a more specific question if you have it. Do you have or recommend any resources or strategies for mindfulness that would be helpful for skin picking? Oh, yes, God, anything. So my go-to practice that I recommend for people is to use body scans, because body scanning will give you better awareness of what's happening in your body. So you will be more aware of the mindless aspects of picking. And body scan will also allow you to identify urges earlier. One thing that I find that people struggle with is what to do when the urge becomes very intense. And then we spend a lot of time trying to find specific competing responses for them, whereas a more elegant solution is that you develop more awareness of what's happening in your body. And then you can catch the urge before it becomes strong so that it overwhelms you. So body scans would be something that I recommend. You have a ton of apps that you can use. So I think the most popular meditation app out there today is it's more popular, and I can't remember the name, Insight Timer. They have really a lot of meditations to choose from, but then there's Meditation Studio. I'm just looking at the apps I have on my phone. Then there's one app that's called Meditation. For me, that's my favorite app. It has a very, I don't know if you can see it, but it has a very specific appearance. It's this blue blob. That's its logo. I really like although it's a paying app, you have some free meditations and some that you can download. I find that every type of meditation comes in 3 different lengths. So there's like 6 minutes, 14 minutes, and 21 minutes, I think. And they're all guided in a very careful, very gentle way. So I really highly recommend them for anyone who's a beginner, because then you can start from 7 minutes, work your way up to about 20 minutes, and they include a wide spectrum of meditation practices so you can try out and see what works best for you. But for picking, I would recommend that you start with body scans. However, the more you try out, the better you will adjust it yourself. I have been picking a lot. I have a lot of scabs all over. Is it okay to go swimming at a pool? I love going swimming, and I do go to the pool, but it's very embarrassing. So there are 2 sides to this question. One would be a more practical, let's say, dermatological side, which is that if you have open sores, and if they're very big sores, maybe it would be best if you wait for them to heal at least a little bit, because you don't want to have an infection on top of what already is a painful issue. And then in terms of embarrassment and shame, that's a very big issue when it comes to skin picking, and I really don't have time to cover it now. But I think if you can go to the pool, if you can have someone that goes with you, someone who can be very supportive and helpful, I think that can be a very empowering experience, and it can help you shed a lot of the embarrassment and shame. But if it's very overwhelming, I would advise you not to until you're ready. So yes, unless it's incredibly overwhelming, because the idea with these kinds of things is never to overwhelm you additionally. Can skin picking be cured completely? Yes. That's the shortest answer. What kind of specialist or therapist do you look for? I'm not sure that I understand the question, because I'm a therapist. So you're asking me for skin picking, what you would look for. So you would typically go to a psychotherapist, or to a psychiatrist. Psychiatrist is more likely to prescribe you medication. Psychotherapist is obviously going to do therapy. So what you would go for is what you think would suit best for you. I would, of course, be more inclined to say psychotherapy, but then obviously I'm biased. But I gave you a sort of short overview of what works, what doesn't work. What you can also do, if you can financially afford it, which is combine both. For skin picking, I didn't find any studies that would tell you whether combination of treatments, so the pharmaco treatment and the therapeutic treatment, whether or not that would be the best combination. But for example, for psychotherapy, we know that sometimes having a therapist and having medication parallel to each other, so at the same time, can have a sort of synergistic effect, and they can work better than both therapy or medication alone. Do you ever use COM-B model for treatment, which is common? Yes. So the self-help book that I recommended is actually based on the COM-B treatment. SkinPick is not based on it, but sometimes if it's necessary, I will introduce some elements, because there are some elements of it that I really like and that I find that are functional. And as you can see by now, I have a very eclectic approach. So I will try to include anything that I think may be useful for clients, or anything that clients would like to try and that I'm able to provide. Is scratching the same thing as skin picking? Yes or no, that depends if it's compulsive, and it depends on the kind of damage that it causes. So it can be, but it doesn't have to be. Are there any books on skin picking that you would recommend? So there was one that I already recommended. You can go to the SkinPick website. So I don't know exactly where, but somewhere on the website, you should have a recommendation of of certain, there are a few books that are recommended there that you can read. They're all decent books. How do you make parents understand? When I was little and would pick, my mother would slap my hand, which just made me feel worse. Yeah, so I definitely would never recommend a parent to hit their child under any circumstances, unless you're about to put your head in the oven or something so horrible. So that's definitely not a good way to do that. What I would, so you can always refer your parents to the SkinPick website, where you have, you can also download somewhere like a PDF with information about skin picking disorder, so you can have them read that. What I would basically convey to them if I had to select something, which is that criticism doesn't work, and telling people to stop doesn't work, and yelling doesn't work. Skin picking is compulsive, which means that you don't have conscious control over it. It does you more than you do it. That's the shortest way that I would explain it to someone. I think there's also one thing that you have to take into account, which is that when it comes to their children, parents are not the most rational beings in the world. This is because they do want the best for us, but so sometimes it does take repetition. If you have a therapist, you can also, presumably this question was asked by a teenager, so you can also ask your therapist to share some information with your parents. Because if they don't trust you, they will trust someone who's qualified. Oh, I just accidentally marked one question about ACT as answered and I didn't read it. I'm really sorry. So if I don't answer your question, please email me. This has been great. I want to say thank you. Well, you're welcome. I'm happy that you enjoyed it. Has there been any reason found for this disorder? So this was, I assume, asked somewhere in the middle before I came to the part where I mentioned Kelly. So far, science has no definitive answer to why someone picks their skin. There are many findings, there are many assumptions, there are many theories about it, but none that work for everyone. And seeing how psychiatry and neuroscience has been developing, and sort of there are many beautiful results that have been sort of described and discovered in many wonderful theories, but there's really not a single theory that describes, we don't have a universal theory of any disorder. So I don't think we will have one either, because I think the human experience is just too complex. We can come up with theories that explain picking maybe for one group of clients, but I don't think we'll have an explanation of picking for everyone. Because at the end of the day, just remember, picking is a movement. So it's like a series of movements. It's not like we're explaining antibodies. So it's a behavior. Behavior can have so many different causes that I think it's really lost cause trying to find just one thing that causes it all. It's much, I think, better and productive to look at different theories and then just see what works for specific clients. Any suggestions for those of us dealing with increased symptoms during quarantine? Yes, go to SkinPick's YouTube channel when you receive a link after this. You will find a whole webinar that I had about anxiety and COVID-19 and what you can do. So there are many strategies that I suggested there, so I would strongly advise you go and take a look at that. I started skin picking when I was a teenager, and now that I'm in my 50s, it's worse. Why would this be? So where I would go looking for an answer to this question is, how has your life been changing and how different life events have affected picking? So picking in itself has no reason to become better or worse. It's the way you think about picking, it's your mental state, your mood, it's what happens to you, what happens to your loved ones, where you live, how current, I don't know, cultural, political, whatever kind of climate, literal climate affect you. So there are many things that can really affect your picking. So what I would do is I would maybe look back at my previous, so my life in the past 10, 20, 30 years. And then I would make a little timeline and see which events coincided with picking being worse and what coincided with picking being better. And usually you can reconstruct a kind of narrative that tells you what usually affects picking. It's really very different for different people. If you were present at the last month's webinar, I gave you one story where I specifically analyzed with the client periods when she was picking and when she wasn't picking, and then we were comparing and contrasting them. So maybe you can go back there and see if there's something for you. Maybe you can copy the way they work. I've been taking venlafaxine for depression for close to 10 years. I read online that it can help with OCD as well. Do you think it could be helpful with SPD, or might it be worth considering changing onto a different antidepressant? So, like I said, I presented the evidence for the drugs that I could find evidence that it works for. So, if you found the study, I would be very grateful if you could send me a link, because I would really like to take a look at it. I'm not aware of it. Whether or not you would change to a different antidepressant depends on many factors. I think if this one works for you, maybe you don't want to change it because the next one might not work as well. This happens sometimes with antidepressants, that you have to try out several before you will find the right one for you. So if it works for depression, I wouldn't risk relapse just so that you could address skin picking. Maybe what could be better is if you try a more therapy-based approach for that, or a self-help approach as well. Ultimately, the only person that you should discuss changing medication with is your psychiatrist. I mean, I have no vested interest in this drug or that drug, but I very frequently see people sort of coming and before, when I was working in a hospital, coming and then asking for changes in treatment because people have seen advertisements of medication and stuff like that. And in my experience, that doesn't really always benefit the client. So I would find a psychiatrist that I trust and then work with them. Is SPD linked to low self-esteem issues? I haven't seen studies specifically working with self-esteem as a kind of construct that you measure, although there are studies like that for different conditions. But if you go back to the schema studies that I've shown, I think you can find ample evidence right there that it's connected to low self-esteem. And in clinical practice, that's one of the most common things that I see. In fact, many times people actually, one of the first things they will say is that I'll have my self-esteem back or my self-confidence back when I stop picking. And sometimes in attempts to fix your self-esteem by fixing your skin, you end up sort of making things worse. So it's definitely a very important topic for many people when it comes to treatment of skin picking. I have an issue with my lips where they become extremely dry and cracked. And if I don't take the skin off my lips every single day, all the skin dies and it looks gross. So my lips will bleed a lot since the skin doesn't just die all at the same time. And all the doctors have told me to do is apply chapstick, and it doesn't help. So applying chapstick is one thing that you should definitely keep doing, because your skin needs to be moisturized so that it looks smooth and so that it doesn't have the dry patches. One other thing that you can do is, for example, use a chewing gum. That's a frequent competing response for people who pick their lips or bite their cheeks. That usually tends to work. So the one thing from what you wrote there is no one's lips are constantly dry. So maybe you can pay attention to what is it that you do for your lips to be that dry. Even if you apply chapstick and they're still constantly dry, maybe there's something about, so try to bring in more mindfulness to that area of your body and see if it's just the skin that's dry that you have to peel off, or if there are some other things that you do, maybe touching your lips frequently or licking your lips or something along those lines, and then try to first take care of that. That could also help. Otherwise, I would really need more information to be able to say. What are your thoughts on medical cannabis for SPD? So medical cannabis is very fashionable now, and I'm I don't know that it's effective for SPD. In fact, I find sometimes the people who use weed actually pick more because their inhibitions are lower. So it tends to backfire. But then for people who are anxious and then anxiety is what causes them to pick, it can help because it will lower your anxiety for a while. I don't really mind cannabis use either way. I just think it's really hyped up. And that's similar like with mindfulness, for example. When about a decade ago, when mindfulness sort of exploded onto the scene, suddenly you could see that it works for everything. Like it basically can cause world peace and treat brain cancer. I'm of course exaggerating, but that's what it seems like to me. And I've been a mindfulness practitioner for a very long time. I teach mindfulness and I've been practicing it for over a decade. I have a daily practice. I love mindfulness. I cannot say enough good things about it, but it is absolutely not a panacea, and it doesn't help with everything, and it's not a be-all and end-all of psychology. And the same goes for medical cannabis. I think sometimes people just want it to work. You know what I mean? I mean, it's definitely helpful, don't get me wrong, for many things. I just don't expect it to work for everything. Skin picking, trick, OCD, SPD, anxiety since age 6. I'm 50 now. I've tried so many therapies and yet still I pick smoothing imperfections. Escitalopram is a hope. Seeing my children pick too. I also have polycystic ovaries, hypothyroidism. If it's helpful for you to know. Thank you so much. So I'm not sure what your question is, but if you're asking me whether escitalopram is a hope, judging by that one study, yes, it is. But I would not get my hopes up. But then I'm originally European, so we're, Central European. We're very pessimistic, morose, morbid people. So I'm not very hopeful as a person. But I find that pessimism protects me from disappointment sometimes. So I wouldn't really get my hopes up that much. It's one study with less than 30 participants, but it is definitely something that should get more attention and more research. But at this stage, I felt sort of obligated to present it. But at this stage, I think this is something that's more of a research interest than it is a viable thing. So when we have one or two more studies that show that it works, then I would get my hopes up. Thank you so much for your thoughtful and helpful talk. As someone who suffers from SPD and is a neuroscientist, I appreciated neuroanatomy today. Well, thank you. I'm thinking about starting NAC, finding a therapist. Well, I have TED PubMed articles pulled up to read. Do you have any quick tips on starting NAC on one zone? So the dosage is written there. I would start with the lower one and then slowly increase. The reason is that if you start with the 3 grams per day dosage, it can cause some mild side effects, discomfort and stomach aches and stuff like that. It's not going to cause anything serious, or not likely. Let me just put it out there immediately. So I would start it slowly and then taper over a week or two, maybe. Good luck with NAC, and if it does work, and keep up using it for at least 12 weeks, like that study suggested. And if you remember, if it works for you, please drop me an email. I would be really happy to hear your experiences. And since you're a neuroscientist, I mean, you know what you should be doing. So go and do some studies, because we really need more research on this. My skin picking area is on the feet and cuticles. Do you think benzodiazepines help with STD? Currently on Klonopin and don't notice it helping. No. Benzodiazepines will lower your anxiety levels and maybe relax your muscles. That's one thing that they will do, although not very intensely. And that's about it. They're not going to help you with SPD in terms of curing it, but if anxiety and stress are triggers, it might help to a certain extent. The long-term solution, however, would still not be to use benzodiazepines since they are addictive. The long-term solution would be to find healthy ways to cope with anxiety. There are so many techniques out there for mindfulness, progressive muscle relaxation, CBT. There are so many ways to cope with anxiety. Oops, reacted to Lexapro, never mind that aspect of the question. Okay, forget it then. Can compulsive skin picking cause skin cancer? No, I wouldn't go so far to say that compulsive skin picking can cause skin cancer. Compulsive skin picking can cause chronic inflammation, which can have its own consequences, but directly to cause cancer, no. Maybe I missed it, but are there studies about the success failure rates of medication and therapy versus therapy only? You didn't skip it. There is nothing about this that I could find. I really did try. It could be that I missed something, but I didn't find it. There are some studies like that for depression, anxiety, I think even for hair pulling that I can think of right now, but not for skin picking. Also keep in mind that I'm just one human being, that I cannot possibly read every study that exists out there. So I have to sleep sometimes. Has there been any reason found for this disorder? So I answered a version of this question before, so let's not repeat ourselves. What can I tell family members and friends who think my skin picking is just a bad habit? So I gave a similar advice already to someone whose parents don't really understand it. I would explain that it's a compulsion, and I would freely compare it to OCD because it is on the spectrum and they share that sort of compulsive quality. But I don't think I would bother very much with explaining something like that to people who are my friends and family members. I would just insist that they accept my problem and treat it the way I need it to be treated. Why? Because if they love me, they will want to help me. And if they want to help me, then they should help me the way I need to be helped. So you can come up with what would work for you and then sort of talk to them and see if they can help you the way you need help. Whether or not it's a bad habit or a compulsion, what does it matter if you still do it and you still suffer? If they're your friends and your family, then they should sort of just accept it. The reason why I'm really having like an emotional reaction to what you're saying now, because no matter what type of issue that I work with, whether it's skin picking or something else, so many times people will ask me this, like, how can I get my friends to accept this? Your friends should, by definition, be able to accept the problem because that goes with being friends with you. So, as long as you don't pick their skin, they should be able to accept it and not question your version of the story. Like think about other issues. If you say, I don't like to eat certain foods, would they say why? Would you justify why you don't eat pizza? No, you don't need to justify anything like that. You just don't. And the same thing goes with this. If you say that it's not something that you can control, as your friends, they should be credulous enough and trusting enough and just believe what you say. So yeah, to me, that's just basic respect of another person. I don't even think it's a very complicated therapeutic question. Sorry, I got a little emotional there. Okay, so this is a double question. Would you consider doing research on SPD, and if so, what would you focus on? Well, I'm a very curious person, so I would consider doing research on many things, but unfortunately, like other humans, I have to sleep and make a living, so I don't think I would be doing any research in near future. I was thinking about writing case reports and sort of to present in a more to sort of formalize the way I approach skin picking and then see if I can maybe publish that in a peer-reviewed journal so that other therapists should have something to start with when they want to work with other people who pick their skin. So that's something that I was thinking about. I think doing scientific research is not just a matter of my interest. You have to be affiliated with an institution. You have to get funding for it. It's a very long and complicated thing. This is why I said that I have to sleep sometimes. It's a full-time job. Yeah, another double question. How many people have this condition? I'm in South California in USA, and all people, including medical professionals, look at me like I'm a monster and are not aware of it. So I'm very surprised that there are medical professionals who are not aware of what skin picking is. It's in the DSM-5, so any mental health professional should know what skin picking is. Maybe they haven't read a bunch of research about that or psychological theories, but I'm really very surprised that they don't know what it is. So the statistics that I have and that I presented in the beginning is that up to 5.6% of people have it, so it's not even that rare. But there's one thing, although I would like to say in defense of my colleagues, which is that this is not a complaint that people often get. So not many people actually go to a psychiatrist or a psychotherapist and say, I primarily want to work on skin picking. So it's not just that they don't want to work or that they're lazy or something like that. It's just that they really don't frequently hear that complaint. That doesn't justify ignorance. Everyone who is in the field of mental health should know what dermatillomania is. But they really may not have had a patient that deals with it. Actually, just today when I was answering messages on SkinPick, one of the clients, or one of the newer clients, said that so they have been picking for 6 or 7 years, and they've had therapy for depression and anxiety, and therapy was quite successful, and they were happy with it. But this whole time, they never mentioned to their therapist that they also picked their skin. So that also tells you that, you know, the amount of shame associated with it, and also that sometimes people don't actually consider it a problem for a long time. And people will pick their skin for a long time and not think that it's an issue that can be dealt with. Do people with SPD or any OCD for that matter tend to be more nervous or worriers? Well, yes. So the OCD, if my memory serves me well, is classified in the ICD-10, so International Classification of Disease, is classified in the F4 category, which is anxious anxiety disorders, basically. So yes, that would fall within that broad scope of disorders, because anxiety is something that permeates OCD and skin picking as well. It's like an underlying symptom. I attributed my SPD to my nerves. That's one way that people go about picking for many years and not realize that it's an actual clinical issue. Okay. I came across a paper saying skin picking could be a result of overstimulation or understimulation, and picking was a way for the brain to cope with that. Any comments on that? Well, it sounds very general when you put it that way, so I guess I can say yes, maybe. I would need more specific details because simulation is a very general term. But one thing, now I'm thinking sort of about clinical examples that maybe I can give because I prefer those at the end of the day. Oftentimes people will say that picking helps them focus, for example, because it sort of removes unnecessary stimuli or sort of directs a kind of, let's say, nervous energy into picking, which then allows them to think without the distractions of that sort of hyper-excitable state. So maybe that could be an example of that. Thank you very much. Great presentation. You're welcome. I'm happy you enjoyed it. Okay, some of the comments that you've been sending are doubled. I don't know if this chat is malfunctioning in some sort, but it's the exact same thing 2 or 3 times. Could you explain the studies on the brain structure again, what it says about the areas of the brain that are responsible for sensory stimuli? Are these more prevalent with STDs? With SPDs, sorry. I guess I'm tired of reading, and this was a weird misread. Something I'll have to think about from a therapeutic point of view. To go back to that study, so what that study showed was that there is a correlation between how thick or thin certain parts of the cortex are and how intense symptoms of skin picking are. That correlation was inverse, meaning that the more intense the symptoms were, the thinner the cortex was. The areas that were affected by where these changes were sort of discovered are areas that have to do with tactile processing, and that have to do with that could sort of explain why, for example, the lower parietal cortex was thinner in those people who had more intense picking symptoms. Yeah, I don't know what I'm talking about anymore. Sorry. I'm a little distracted at this point. So yeah, the cortex would be thinner if your symptoms were more intense. And that specific area has to do with tactile processing, and it has to do with pleasure that you get from picking and from sensory data. So that's the connection in a nutshell. The paper is available, so you can download it and read it yourself if you think you would be able to understand the terminology. Do you find that certain medications can exacerbate skin picking, Adderall specifically? My therapist seemed to think the withdrawal at night could be causing anxiety that leads to SP. So for sure, withdrawal can be related to anxiety. And I don't know about any, so I've seen clients claim both in terms of how Adderall affects them. So I don't think I can say either way for sure, but definitely people will connect effects of Adderall to skin picking one way or another. There are some studies with trichotillomania, but I don't know that they're applicable to what you're specifically asking with skin picking. Can you pace yourself through your online course? I have major energy issues that may take time to complete. So yeah, the program takes 8 weeks to complete, but you of course don't have to do it for 8 weeks because you can do it longer than that, or you can do it shorter than that. You cannot complete the whole program in a shorter time because sessions unlock one per week, but you can take longer if you like. Now, in fact, a lot of people choose to stay longer because they like the accountability that it provides. So you can join and then work at whatever pace works for you. It's just important that you discuss it with your therapist so that you can both have an agreement about, what's okay and what the therapist can expect and what is it you can offer at a given time. Has there been any attention paid to astrological sign and the prevalence of SPD in a particular sign? I can almost with 100% certainty claim no. I don't think any scientist would study this for whatever reason, but scientists don't tend to study astrology, so I'm absolutely certain that there isn't. Whether or not there's actually any connection, I really don't know, but I can absolutely tell you that there are no studies about this. Yeah, so it's just not something that would be particularly useful for scientists to study, I think. For example, in therapy, I don't really know what I would do with that information. But then again, I really know absolutely nothing about astrology, so then maybe it makes sense why I wouldn't know about what to do with it. A question accidentally marked as answered. Thank you. Can ACT be effective if using online-based resources if I'm able to do it at a clinical practice? So the SkinPick program is effective and it is based on ACT. So the answer to that question is yes. Okay, so this has been very informative. Thank you. You're welcome. Is it self-mutilation? Are we punishing ourselves for something? So as far as psychiatric classification goes, skin picking per se is not a form of self-harm. So that's a completely different thing. However, in my experience as a clinician, sometimes self-harm is one way in which we can see and understand skin picking, especially if it coincides with some other psychiatric conditions where self-harm is a part of the clinical picture. So for example, I mentioned borderline traits in one of the slides. One of the common symptoms of borderline personality disorders, I dare say even maybe a hallmark symptom, is self-harm. So when you have the two conditions coexisting, it is worth asking, is skin picking maybe a form of self-harm for that specific client? But that is not a general answer that I would ever dare to give. It's something that I would only maybe, not just me, it's something that client and I would decide while discussing it. So it's really on case-by-case basis. I'm very careful with this because in psychology, self-harm has a very, and self-mutilation have a very specific meaning, has very specific meaning and very specific way of looking at it. Is there anything a person can do to heal wounds faster caused by picking? So yes, I'm going to give you some very general quick advice for that. So one thing that you can easily do is take vitamin C supplements. Vitamin C helps with collagen synthesis, which is absolutely necessary for your skin to heal. You can take vitamin B supplements. You can use some kind of moisturizer, cream. And one other thing that you can do is that if you absolutely must pick and you cannot resist it or apply any competing responses, then as soon as you finish picking, make sure to clean your skin and use something that has antibiotics in it to prevent any infections. So that will also help. Also, if that's possible, if you have that degree of control, you can also make sure to clean that area before you pick as well. Is it found in women more than in men? Yeah, I didn't include that data because I didn't find any specific numbers that I thought would be useful, but it is more common in women in general. And I can, since it's similar to trichotillomania, I can tell you that trichotillomania is 9 times more common in women than it is in men. So, and this also is as well. Is there a large subportion of the SPD community that puts what they squeeze out on the mirror? I heard it's common. So it is something that clients share with me frequently enough that I do talk about that on a weekly basis, but I can't tell you exactly how common that is. It is common to chew the skin, to touch it with your fingers, to sort of look at it closely. There are many types of behaviors that are sort of related to what you do after you pick. So yeah, it is quite common. Regarding acceptance from friends and family, if someone is shooting up drugs, that's supposed to be accepted. SPD is self-destructive. When I said acceptance, I don't really mean that we should consider it good. But for me, that means that if I tell you that I'm struggling with an issue, and that this is the kind of help that you can offer, or that this is how I see the issue, for me, accepting that is a matter of respect. I don't think anyone, I mean, if anyone else understood that acceptance means approving of something, then I apologize for not being clear enough. So that's definitely not what it means. But what it means is that if someone tells you that it doesn't help you to criticize them that they pick, but instead maybe it helps you do something else, like maybe validate if you see that their skin is getting better, or instead of saying stop picking, maybe hold their hand, or something along those lines, then you should really do what people tell you, because help is what helps, not what you think it helps. There's a similar issue there. There's a parallel that I can make with something that I also commonly see with people who suffer with depression. For some reason, people who are not depressed very frequently feel the need to tell people who are depressed that everything's going to be fine, that life is really very great, and they should just cheer up. That is absolutely the worst possible advice you can give to someone who's depressed, because they are depressed, so they cannot see what you're saying. They just don't see that. It's like, me making you eat spicy food and telling you, no, it's really sweet, eat it, you're wrong. It's like, it doesn't help to contradict someone's experience. It doesn't mean that if someone says, I'm going to shoot up drugs, you should say, go ahead, I accept it. Absolutely not. But if you don't accept it, how do you help them? Acceptance just means that you're able to see the problem very clearly. And accepting someone's story of their problem is being respectful. And I also think that there is a difference between drug addiction and skin picking in terms of behaviors that are associated with it. So you're not going to get that, there's a certain degree of manipulation with people who need to get drugs urgently and stuff like that you just don't see with skin picking. So I don't think it's a good parallel. Is it helpful to go to a dermatologist while dealing with SPD, or should one wait to overcome it? By all means, go. If they can give you something, if you have acne, for example, or skin changes that they can address, I think that's a great idea, because that way you will reduce your triggers and make your treatment, sort of the psychological aspect of the treatment, much easier. So yes, if you can do both, do both. Sorry. I think it's the time difference causing the questions to be delayed. No, that's not what I meant. I meant that some questions are literally pasted 3 or 4 times. So I think it's something related to Zoom, because I don't think a certain one person would just copy paste the same question so many times. I don't have questions. Just wanted to thank you so much for taking your time to talk about this and for answering so many questions. You're welcome. I'm happy to answer if I can. I think this is also a good time to sort of slowly bring this to an end, because this has been, we've been at this for over 2 hours right now, and I'm losing my voice, as you can see. There's still some questions that I didn't answer, and there are over 388 things in the chat that I did not even get to scroll through, so we could stay here until tomorrow. So let's end now, and I hope to see you next month. We will be talking about emotional regulation and how that relates to skin picking, and what is it that you can do to, to have better regulation of your emotions. So I wish you a pleasant evening or night or morning, depending on where you are, and I hope to see you next month. Bye.